Hello, everyone, and welcome back to Neurology Education's Meet the Author series. I'm Dr. Galina Gaichman, and I have the pleasure of speaking with authors to meet the person behind the paper and share the stories behind the studies. Today, I'm joined by Dr. Clare Lambert. Dr. Clare McGarvey Lambert earned her medical degree from the Royal College of Surgeons in Ireland and completed her adult neurology residency at Yale, graduating with a distinction in medical education in 2025. She's currently pursuing a Neuroimmunology Fellowship at Johns Hopkins Hospital. Her med-ed research focuses on gender inequalities in residency awards and developing novel teaching tools for residents. She serves as a trainee board member for the Neurology Education Journal and is a member of the Osler House Preceptor Program at Johns Hopkins Hospital, where she teaches medical students during their outpatient neurology clerkship. Clare is the lead author of a recent research article published in Neurology Education entitled Education Research: Guided Worksheets to Support Residents as Clinical Teachers in the Neurology Clerkship. Welcome, Clare.
Thanks so much for having me.
So in this study, you and your colleagues did something very interesting. You developed guided worksheets that supported residents who were teaching medical students on the neurology clerkship. And then you evaluated both learning outcomes for the students and the perspectives of the residents using the worksheets. You found that the tools improved student knowledge and helped residents feel more confident and effective. If an educator listening to this takes just one thing away from the study, what do you want them to do differently in their teaching or in their educational programs?
I think this work was really geared towards the early educator. And so for the early educator, I would want them to first of all just take away the idea that stepping into that role of teacher when you're a resident, so you're also a learner, is really hard and people think it's hard. So I think that was, talking to residents that got to use this tool that is so clear in the themes that came out. And then I think also just to understand that there are tools and frameworks that we can use to make things easier. When you're still getting a grasp of the information yourself, it can be really hard to articulate that eloquently to a learner. And I think people get a little bit nervous about, getting it out of their depth. And so using a framework that you can fall back on and say like, okay, this is going to help keep me structured, keep me focused, and make sure I don't miss out on anything can just really take away a lot of that cognitive load. And so even if like our frameworks don't work for people, there are frameworks, just even locking in a chalk talk or having like these like micro learning experiences in your back pocket that you can pull out can just really make such a huge difference, both for the teacher and the student. So that would be kind of the main thing I'd want those early educators to take away.
I really love that. I remember seeing one of my clinical educators give a talk and it was superb. And I was like, how did he whip that up? And then a couple months later, I saw him give the same talk and I realized, oh, maybe that was practiced. So let's go back to the beginning. How did you first get interested in this topic? Was it a personal experience in residency or something else that motivated you?
I think there was a couple different things. I found as I moved further along in my training, the complexity and the depth to which I understood the concepts was changing and growing. But I kept always thinking back to when I was the med student or when I was the intern, being really overwhelmed when attendings would try to explain something kind of at their level, and then getting scared of neurology, and at some points even not sure if this was the right specialty for me. And so I think that that's part of kind of where this neurophobia comes from and why students are a little bit nervous to pursue neurology is they get these kind of like lessons and chalk talks from these super experts that are explaining things at like a really high level. But at the end of the day, neurology can be broken down into simpler, like bite-sized chunks. And so I felt like there was this gap where we just expected residents to be able to do that. So as their knowledge base is growing, we expect them to be able to put it into those bite-sized chunks for learners and to know what they don't know and fill those gaps without really giving them the skills on how to do that. And so I felt like there was an opportunity here to introduce something that could be easy, off the shelf, like relatively simple to use, and kind of fill that gap so that while your own landscape and your own kind of depth of understanding is changing, that you can still kind of break it down into its simplest building blocks for learners and keep them engaged and not getting overwhelmed like that. So that's kind of where the idea came for me and kind of why I got motivated to create the worksheets in the first place.
I'm all for anything that helps us not commit the crime of instigating neurophobia in others. For
Totally.
listeners who haven't read your paper yet, because they're surely going to run to it right after, can you walk us through what you did to create these guided worksheets? What did they look like? How did residents use them during the teaching sessions with medical students? And did you prepare the residents to be able to do that effectively?
Yeah, so I think we really started with just these kind of like basic inpatient topics that everyone needs to know, even if they aren't going to end up being a neurologist. So we went for MRI, stroke, hemorrhage, and seizures. And then we just tried to kind of take it down to the building blocks, create this sort of web of ideas or kind of like a scaffold of ideas, a framework for how you can approach these problems. For reading MRIs, more like how do you approach the reading of an MRI? And then for the other ones, how do you approach kind of the initial diagnosis, workup, and management? And then we kind of filled it in like, what would I want a student to take away from rotation? Then we drew it back and erased kind of components of the worksheet. And so what we're able to do then is give the resident the filled in version. So they could just grab it out of the folder. They don't need to prepare. They don't need to like really even know what was there before. And then you give the blank or partially blank one to the students. And then I didn't prepare the residents at all. I wanted to see if this could fly on its own. So I just sort of said, like, do whatever you want with it. Try to let the students take a stab at it and let them guide the session. And so you could really quickly see where their deficits were, what they didn't know. And then it gave the resident the opportunity to jump in there and clarify those key points. And then if students kind of like could go in deeper and say, oh, well, I have more questions about this topic, the resident could kind of go back and forth with them. And so sometimes I observed residents like not really even getting through the whole worksheet and they would just like really hone in on one component of it, which was totally fine because we wanted this to be like flexible and to meet the needs of the learners. And then some of them kind of used it as a really structured framework and then kind of reflected back saying, one of their biggest fears around teaching was that they might kind of get off track or lose out on a really important piece of information that they meant to tell the student but got sort of sidetracked, that they were able to use the structure to make sure that that didn't happen. So it was really interesting to see the different ways that different groups of students interacted with different teachers and how they kind of use the scaffolds a little bit differently.
It's really helpful to imagine these worksheets. On the one hand, they're very pragmatic. You said, like, here they go, put them out there, give it a try. And on the other hand, they're really adaptable and flexible, and they allow this interaction and relationship to build. And I'm struck by the fact that it's involving some adult learning theory and active practice for the students as well. So you were able to infuse that in. When it came to evaluating the study, and this is something that we, of course, in neurology education are always curious to think about that level of research. It was interesting to me that you thought about talking to both the learners and the teachers, and you found that this intervention benefited both of them. For the students, they were able to demonstrate increased knowledge, and for residents, they felt less anxious and more organized, as you said, not missing those key points. In terms of thinking about your evaluation, how did you go about choosing to study kind of both of these elements as outcomes?
Yeah, that's a great question. So we were really interested in the resident experience. So this was like the population we were interested in studying was these people moving into their teaching role who are also learners, because I think that's a group that's really important to target. We want to get people having like good teaching habits and getting really passionate and inspired by teaching early in their career, as opposed to having it be this thing that's a little bit intimidating, that makes them nervous, that's a drain on them cognitively and hard to fit into the day. So that was the goal. But then when we look back at it, we were like, no one's going to take this intervention seriously if we can't also show that it worked for the learners, because of course the learners are arguably the biggest stakeholder when you're kind of putting forward a new intervention, even if our main kind of population of interest is actually the teacher. So we decided to take this sort of two-pronged approach, but we wanted to really dig into the resident experience using more of a qualitative analysis, whereas we kind of did this student assessment just through some like very brief multiple choice questions and then a satisfaction survey that was very brief. We opted for brief assessment in the students because it can be hard to get kind of the buy-in from medical students to fill in a lot of data for us. And we were also trying to get a little bit of delayed follow-up, so 2-week follow-up, and knowing there'd be a big attrition. We didn't want to be overly burdensome in what we're asking of them. So we did sacrifice a little bit on our depth of understanding of how the tool worked for the learner. But I felt, we're really targeting the resident more. So that's why we went in for like the full qualitative analysis with them. And I think it worked. There was definitely some drawbacks, and if I went and redesigned the whole project again, I would do things a little bit differently, but this was kind of our first time putting forward this type of an intervention, and so it was definitely a big learning curve.
Well, I was talking about why this worksheet was helpful for residents, but I think you alluded to it a little bit, just that less anxiety about what to say about missing something, having some structure to kind of hang their teaching on.
Yeah, and I think it's like these are things that you know, but then getting to articulate that in a way that's digestible to someone who has a different knowledge base than you is a whole different skill set. And so I think it just helps bridge that relatively small gap, but it can feel like a big gap when you're a resident.
Absolutely. It was kind of cool to think about you talking to your colleagues and learning from them as a fellow resident in training. And I was curious, was there anything that you learned through this experience talking to them that surprised you? Was there anything about how they were using them or what they were experiencing teaching like that you didn't expect to find?
I was I was struck when I spoke to my colleagues just about how similar our experiences were around teaching. Because I definitely, when I was designing these, I felt like in some selfish ways I was making this thing to help make my life easier because I was struggling with finding a way to teach quickly, cohesively, and during a busy service where you're being pulled in multiple directions. But it was really interesting to talk to my colleagues to learn that they were having the same struggles and the same experiences. And I think it's just something we don't always talk about. So that was interesting. I think the other sort of thing for me that was interesting was that how hard it is to sort of change a culture in academia and how hard it is to get a new intervention kind of out there and used because everyone gets pretty stuck in their ways pretty quickly. And so even targeting PGY for senior residents as the teachers in the study, a lot of them already had their own chalk talks like developed in their back pocket. And so the lift for them to kind of figure out this new thing, realize like how to use it, when to use it, what it was going to be like. It's a bigger lift than I expected. And so I think some of the feedback we got from reviewers was like, well, this is kind of relatively low uptake, even amongst your colleagues that want to support you. And how could it perform in the real world? And I think it's a great point because I think it's something that we all struggle with as medical educators when we're trying to put a new innovation out there is just that people are really stuck in their ways and this is supposed to be something that's like making people's lives easier, but that first step can be really hard to take when you're unfamiliar with the tool. So that was something that surprised me too.
That's interesting. It makes me wonder about an earlier implementation. Like, I wonder if you were catching folks after that awkward phase where they're facing this challenge and realizing that they just got to do it, and whether it might support even earlier trainees. We certainly have junior residents who are teaching the medical students too, and I don't know if that would be a feasible opportunity, but maybe something to investigate.
Yeah, definitely. And that was one of our kind of takeaway future directions was that we should have put this more out even to like the PGY2s who are the ones that are struggling the most to move into that teaching role and also don't have those chalk talks like built up yet. So if I did everything again, that would have been the biggest kind of structural change I would have made.
Big theme that came through in the interviews, and this is something you mentioned yourself at the beginning, was the power of what you might call micro learning. You were saying like these little bite-sized pieces, brief moments during the clinical workflow that allow for meaningful teaching, even if it isn't everyone sitting down, putting everything down and facing the board. So how do you think this concept of microlearning can impact how we approach teaching on busy inpatient neurology services?
Yeah, I think the problem is we go through our whole medical education, like sitting through 10 hours a day of like hour-long lectures with 80-page PowerPoints, and that's what you study off of, and that's kind of your whole life. And then you move into residency and everything's different. You have to completely change the way that you learn, and it ends up being, go, 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 kind of you're being pulled in multiple different directions. And in those instances, those tiny tidbits of microlearning end up being kind of the foundation of your knowledge more so than the lecture that you're getting at noon conference while you're being paged by the nurses and that you might have to go away if there's an emergency. And it's really hard to kind of like lock in and focus for an hour in the middle of a busy day. And so what I found is as residency went on, the most kind of valuable learning I got was just, my colleague beside me saying, have you seen this or think about this when I'm writing my assessment, or someone just writing on the whiteboard, like, this is how I think about hyponatremia and me snapping a picture of that on my phone. Like those ended up being the like really valuable lessons that I learned. And I think as a field, as neurologists, we're starting to embrace that power of microlearning in all different spheres. So there's, little like Instagram videos, TikTok videos, like those end up being so much more valuable than I think they were thought to be in the past. And so I think never underestimate 5 minutes spent teaching a student. And I think that's one of the biggest barriers that residents experience is thinking that they need to stop everything dedicate an hour to like running through a full talk with their students, and that sometimes they don't have that time in the day. So then teaching just doesn't happen at all. Whereas I think it's so important to just do those 5 minutes on round when you see an interesting patient, say quick clinical pearl. So that's one of my biggest takeaways from residency and something I would want the junior teachers to take away as well.
Yeah, I've even heard some educators talk about nano learning, like the 1 point after a patient, or just simply role modeling something so that the student knows, like walking in, I'm about to go talk to the patient about this. Watch me do it. But I agree with you. We got to make it more integrated into what we do every day. Because your study really shows the impact that residents have on medical students, it got me thinking, how can we support residents at the larger kind of program level to do this? So, what does your study tell us about how we can support residents as they are developing those early skill sets as clinical teachers?
Yeah, I mean, I think there's such a variability across institutions about what kind of support residents get. So I think in my residency program, like I had my mentor and my co-author on this paper, Jeff Dewey was such an amazing teacher and I got to work with him so closely. And then my program director for most of my residency was Jeremy Moeller, and at the very end became Sarah Schaefer. So these are all like, titans in medical education that I got to learn from every day. And so I felt super supported as an educator. But I think in some institutions that's not always the case, and so giving residents these kind of like frameworks and a little bit of like extra teaching on how to be a teacher, I think is so important. And there are so many frameworks and so much information out there, it can be a little bit hard to figure out for residents, like where should I be going for this information. And so giving it to residents in like a very digestible, easy manner and working that into part of your everyday resident curriculum, I think is super important. And whether or not that happens at different programs, I only can speak to my own experience. But even just talking to friends and colleagues, like I'm not sure it's so structured everywhere. And so that would be like the biggest way, I think, to get junior educators feeling more comfortable in their role.
Well, that's very fitting. I think you're suggesting a little bit of micro learning about micro learning or micro teaching
Yeah.
about micro teaching. As you look to expand this work to next steps, Claire, what are you most excited about? Is it making new worksheets for different neurology topics, trying different learner groups, maybe our ED interns or someone else, or bridging this work to other institutions?
Yeah, I mean, there's so many different directions that we could take this. And I think Jeff and I, we wanted to find a way, of course, to make this more available to people at different institutions, see how it worked in places that are not our own institution, and just make it like sort of an off the shelf, easy to grab, easy to use tool that's more widely available. So we're still kind of toying with what that exactly looks like. Is that, a PDF? Is it a app? Is it a book? And trying to kind of expand our library of what topics we have. Like we were really focused on those like must know kind of inpatient emergency topics, only 4 topics. And so even like if students were interested in something else, we unfortunately didn't have like a big library to pull from. So building that up to include more outpatient, more like esoteric topics that could even be used at a resident to resident teaching level. Those would be some of our kind of next steps, and then figuring out how to get it more out and available to everyone.
Sounds like you heard it here first. If you have a worksheet idea you want to submit to the collection, reach out to Claire. So, this has been such a wonderful conversation. I've been reflecting on what I took away, and I want to share 3 key takeaways that I think every neurologist and educator should know from your work. First is that, like you said, teaching is hard. Residents are essential clinical teachers, but they do need our support. They're teaching our medical students every day while balancing clinical responsibilities, and these structured tools can really help make teaching more approachable and effective, elevating their role as clinical teachers. The second is that simple educational scaffolds improve not only the learning, but they also improve the teaching. And I guess it's by improving the teaching that they improve the learning. These guided worksheets improve the medical students' knowledge, but also helped residents feel more confident, organized, that they weren't missing anything, and prepared as educators. And finally, the power of micro learning. Small teaching moments can have a big educational impact. Micro learning approaches allow educators to integrate these meaningful teaching points into the reality of the busy clinical environment, and they make education and the commitment to being an educator much more sustainable. Anything to add or anything I missed?
No, I think that was a beautiful summary. And thank you so much for giving me a chance to share this work.
Thank you so much for your great ideas and what you're doing. If you want to learn more, you can find Claire's paper, Education Research, Guided Worksheets to Support Residents as Clinical Teachers in the Neurology Clerkship, on the Neurology Education website. I'm Galena Gateman, and that's a wrap for today's Meet the Author series.